A lot of advancements in this field center on these engineered solutions. What new technology can we create or what new processes can we automate? But on the flip side, it takes a lot of training and a lot of education to be a clinician, whether you're a physician, a nurse practitioner. So you don't go through all of that just to be an automaton. So where is the balance between integrating these new technological solutions and using your clinical judgment?
This is Mark. I think before we start talking about technological innovations, we should at least acknowledge that so many of these diagnostic errors have a cognitive origin, and you really don't need fancy technology. You need to educate the clinicians on the fallibility of clinical reasoning. And physicians have never really heard this before. There was no course in medical school on the psychology of how we make decisions, but human decision making is very fallible. We have limited memories. We don't know about all those 10,000 diseases. We're subject to all sorts of cognitive biases. So very simple courses on trying to educate providers on their susceptibility to these things could, I think, have enormous impact. So we need to focus not only on the technology side, but just also on the simple cognitive aspects of coming up with that diagnosis.
So that's spot on, Mark, obviously. But I've got a question for you, Mark, and others. What about, because part of what I hear as we meet with folks really is, I'm going to say, the time and space to have conversations around diagnosis. So some places have a diagnostic timeout. Other people are trying forums or creating venues where you can really have those discussions. And what I hear from clinical colleagues that are at the bedside, where I haven't been for a number of years, that's hard to find. Does that serve a purpose? Where does that fit in this? Where do those conversations occur? Or do they need to?
Sure. I think what the reason I'm having some pensive time about this is I'm trying to Mark's very opening statement, I'm trying to figure out what we mean by technological solutions. So if it means decision support tools and the kinds of tools that help our providers pull together pieces of the puzzle, but still use their expertise and experience to draw conclusions, is one kind of technological support, which is different from the kinds of tools such as the safety net that Kaiser's working on that helps us sort of explore our electronic health records and the information available there to let us know where vulnerable test result findings live that haven't or don't seem to be addressed. So I've got like so many different, and in between that is test result management tools and systems that just make sure we close the loop on communications and incidental findings. But I think it's important, if we are going to engage our providers in any conversation around diagnostic improvement, I think that we need to assure them on an ongoing and consistent basis that they are, first and foremost, the captain of the ship, if you will, and that their knowledge and expertise and experience and sense of their patients and relationships are the crux and the key. But those things can be leveraged because there's way too many things for them to remember, way too many tests now available. We are so far beyond the good old doc who picked up his black bag and went to my house and told my mom what my chickenpox or mumps were. The healthcare is growing every single day, and it's bringing new diagnoses, new diagnostic processes, new diseases. I just think we need to embrace our providers and understanding that we're not trying to replace them. We're trying to leverage their clinical judgment by finding ways to make the information as readily accessible, complete, and correct as possible so they can then process that information and begin the discussions with their patients that drive the decisions.
Yeah, this is Mark. Dana has it right. The best doctors and the best healthcare organizations are going to be the ones that use technology to augment and complement clinical decision making. So it's not either or, it's using them both effectively. And the electronic medical record is right in the middle of everything we do. And there's really, I think, quite a bit of enthusiasm that in the years ahead, this will be an enormous advantage in terms of improving diagnostic quality and safety. It'll save us time. It'll find the information that right now is scattered all over the place. It'll provide us better access to decision support. There are many, many different ways that technology can improve diagnosis and will in the very near future. There are all sorts of commercial ventures interested in this.
Mark, is this where the Human Diagnosis Project starts to kind of fit in? I mean, because when I think about technology and clinical judgment and I'm going to say tapping the collective wisdom of clinicians who really are the masters of putting all of this together. I mean, the Human Diagnosis Project is doing some work in that space, but on a day-to-day basis in our hospitals, in our practices, it doesn't always happen. I mean, would you call that an example of what you're talking about?
Well, thanks, Chris. Well, Human Diagnosis is a very innovative company. They're doing two things. One is they're trying to get patients to have easier access to specialists if they don't have that access already in their healthcare system. So that's, I think, very beneficial. But the more interesting part is the one you mentioned about using the wisdom of the crowd to help with diagnosis, yeah. and I think that's got a lot of potential. I mean, fresh eyes catch mistakes, and second opinions are very valuable. And the more people you can involve in helping think through a problem, to the extent that they can do that independently and kind of pool their knowledge, that's a very powerful way to improve diagnosis.